All right, parents, we all know the crud is going around. We've been dealing with it at my house. And tonight, an urgent call is being made for federal health officials to help strained hospitals deal with the rise in respiratory illnesses among children across the country. In a letter obtained by CNN, the Health and Human Services Secretary tells governors around the country the Biden administration stands ready to continue assisting you with resources, supplies, and personnel. Dr. Joseph Gigante with Vanderbilt Children's Hospital says the hospital has been filled with flu and RSV patients. He says there are things to look for when deciding whether to take your child to the doctor. If they are lethargic or not going to the bathroom as often as they usually do, they are probably dehydrated and you should make an appointment. And there are also signs to watch for that they may need to go to the hospital.
For those kids who are having really severe respiratory problems, you may see some color changes where they're looking kind of dusky and blue. And honestly, if you see a color change like that in your child, that's actually a 911 call, and get an ambulance to your home to take your child to the hospital as soon as possible.
Dr. Gigante also recommends lifting up their shirt to see if you can see their ribs when they're breathing. It means your child is just working too hard to breathe, and you should definitely call your pediatrician. Another thing he talked about is a shortage of Tylenol and Motrin. Many parents have said they can't find it on store shelves. The doctor recommends using the store brand of Tylenol, Motrin, or Advil. He said to also call around to local pharmacies or check online for that medication. One thing that he emphasized was to not give adult versions to children, saying it's easy for them to get too much and then to develop complications.